My lecture topic is to do or not to do exercise. The part is kind of we know exercise is needed, but is it healthy or unhealthy? We discuss about it and we'll take the decision. I have no financial benefit or any conflict of interest regarding the presented material. Outline of the lecture. First, I give you an introduction about the sport and the benefit of the exercise and how the exercise is going hand in hand with the longevity and side effects of the exercise. Then why we need the screening process, and I briefly describe about the exercise component and the take-home message. And since this is a lecture, I can't do practical component of the exercise, so I will give the theoretical part and we can discuss later. So first thing, what is the physical activity and what is the exercise? That's a two distinct things, but we have to know the difference first. The physical activity is any kind of voluntary movements we are done by our skeletal muscle, which is require energy expenditure. So it means that every movement we are doing is a physical activity. But what is exercise? Exercise also a subpart of the physical activity. It is a planned, structured, repetitive and objective improvement and maintenance of physical activity. So every movement we are doing is a physical activity. If you want to do the exercise, it means you have to be programmed for that part. That's the two different. Right, as an example, there are 9 things in this picture, so we will talk about a little bit about it and see whether it is belong to the physical activity or the exercise. First one is walking. So it is planned and repetitive action, so we can consider it as exercise. Second one is the gardening. So gardening, you never know what you have to do during that time, so it kind of belongs to the physical activity part. Third one is the household working, that also a physical activity. Other one is usually this is the kind of advice we are giving as a doctors to the patient. So if you are not physically active, ask them to get off from the one hole before your destination and you have to walk. So since it is a walk, it's coming as an exercise. Fifth one is walking with the dog. That depend on your dog. Actually, if it is very obedient, it is a kind of exercise. If it's not, it is a physical activity. Dancing also the same. The dancer per se thinks it is a exercise, but the ones who are seeing it can decide whether it is a exercise or the physical activity. Third one is climbing staircase. That's definitely exercise, but climbing staircase is having the two parts. One is we are moving, that means the cardiovascular part also there. Other one is we are climbing. So resistance exercise also there. So climbing is one of the good exercise that you can prescribe, can do. Other one is swimming. That's definitely an exercise. Second one also walking in the house, that also an exercise. So I think you can have a little bit idea about how these two words are using it, because in this lecture we may use this word hand in hand. Right, then is the sport. That is the part we are mostly misguided most of the time. What is sport and what is exercise? So sport is kind of a physical activity and it is exercise also, but it differs with the set of rules and the goals. So we are going to achieve that goal, not like the exercise. So the best definition that I got was the sport is focused on outcome outside the body. Even though you are doing exercise, the outcome rely on the goals, whether you are winning or you are achieving it. The exercise is focused on inside your body. That means you are focusing on your health. So doing sport, we think it is healthy. Sometimes it may not. Right, now we'll go for the benefit of exercise. First, we'll talk about the good part of the exercise. Why we doing the exercise? Why we need to do the exercise? That's because when you take the world, more than 30% of the world is physically inactive, and out of all the deaths, more than 80% is because of the non-communicable diseases, and 77% of our time wasting because of the disability is because of the non-communicable diseases. And exercise is one of the known factor for preventing and controlling the disease burden. Other things are the tobacco consumption and the alcohol consumption and bad dietary habits. So when you physically active, if you are expending more than 1,000 of kilocalories per week, it will reduce your mortality by 20%. So that's why the WHO and the other organization has investing a lot on improving the physical activity, and there's a clear guidance to improve physical activity, reduce physical inactivity by 2030. Right. Again, the benefit of exercise. As you can see in this picture, it's reducing your mortality and reduce cancer risk and reduce your heart disease and the cardiovascular and the depression and the hip fracture and also the dementia. So it is kind of a overall giving benefits. So we can say that exercise is kind of a medicine because it's giving the good result. It's having high affinity and selective towards your target organ. I will discuss about the target organ in the next slide. And it's having the high bioavailability and high effectiveness, and it's low toxicity in the therapeutic range. That's the part that I want to mention it in this lecture. It's low toxicity if you are doing it in the correct way. If you are not, it will give you a bad examples. So when we talk about the target organs, these are the main organs that we are talking about. Cardiovascular system, respiratory system, pancreas, liver, and nervous system, hormonal system, and the musculoskeletal system. So most of us think that when you're doing the exercise, only it affects the musculoskeletal system, but it is not. It will giving overall benefit. These benefits it's giving through the chemical passengers. Still, there are a lot of research going on about how exercise giving this result. What they found is because of some chemical messengers, they are giving this effect. Still, 100% they didn't identify all the mechanisms, but still it is giving some benefits. Right. These are the benefit of exercise. And next I want to talk about longevity, long life, healthy life, fountain of youth. So this is the remedy that the world is looking for over the thousands of years, how we can stay young through our life. So main things is kind of the exercise, good habits, diet, sleep, reduce stress, and the good relationship. And in this part, I will talk about the exercise, how it can increase your longevity, and also what part of exercise which you can use as a parameter to check whether you are having a good long life. So this is a very interesting topic because it has found out that if somebody is physically active and your longevity is increasing than those who are not doing exercises between 2 and 8 years. So how is it happen? We'll discuss about it. And the other important thing is what parameters we can use to check whether you are having the long life. And there are 3 components. I will talk about that detail in my next slides. First is the cardiorespiratory exercise. So the standard way of checking is for the VO2 max test. We are doing as a cardiorespiratory CPET machine, and also the muscle strength. For that one, we using the hand grip test, and the coordination and balance, 10-second one leg standing. Out of these 2, VO2 max is kind of a very sophisticated and complicated way of doing it. You need more facilities. I think there are very less centers in the Sri Lanka is giving this service. So we have to go for the alternative ways to check that one. Another one is hand grip test, very easy one. I think it is not available in our unit. unfortunately, but you can use it in the nutrition department, nutrition clinics, they use it. And the other thing is coordination and balancing. So when I talk about the previous things that I say, I talk about the exercise, but all these benefit of exercise, they were talking about only with the cardiorespiratory part. So exercise is not belong to the cardiorespiratory. There are three components. One is strength, one is coordination. So you have to have these three components to cover to have a long life. So that's the part that I want to mention. Right, so VO2 max value, we are checking with cardiopulmonary exercise testing, and you need lab facility for that one. And the important thing is in here is VO2 max is maximum amount of oxygen the person can utilize during intense exercise. For your long life, what you need is intense exercise. So our recommendation is mild to moderate exercise as the initiation part. But if you want to have a long life, but you have to consider doing vigorous and the high intensity exercise. And the value is depend on several factors like gender, age, activity, and the genetics. The good part with VO2 max is you can increase with your activity, but it reduce with your age, but you can compensate if you are doing more exercise. Right, so just to have a little bit idea about the VO2 max value, when you are working in the moderation, we are using 15 ml of oxygen per kilogram per minute. That's our cutoff level. In average, healthy man is 35 to 40 milligram of oxygen, milliliter of oxygen, sorry. And for the female, it is 27 to 31 milliliter. And highest VO2 max value is recorded up to now is 97.7 milliliter per kg. It was the record by the cyclist named Oscar Svensson. Never heard of it, no? That's the thing with the VO2 max. Even though he's having the highest VO2 max, he was never a world-class cyclist. So this is only one parameter. This is not giving any indicator of your performance. I have seen that one of our cricketer is telling to the media that he's having the highest VO2 max in the said sample, but I didn't see him playing now in the cricket team. So just to not to criticize that, just to have idea that VO2 max doesn't mean you are perfect and you are winning the game. So it depends on another lot of parameters. And the important value for us is this 18 ml per kg. It means if your VO2 max is less than 18 milliliter per kilogram, it means you are risk of having morbidity and the mortality. So if it's very close to the moderation of the walk, it means that if you can, your physical capacity is only tally with the moderation of work and you can't go beyond that, it means your long life is in a risk. So you have to improve your fitness level. So see, I told you that the VO2 max testing is difficult, right? You need facility, but there are some crude ways to have some idea. So there are various formulas to measure it, and this can calculate by using 1 mile walk test and step test and the rowing machine 2000 meter. There are some formulas. I think if I am trying to describe about it, it is out of scope of my lecture, so you can refer it. Next one about the muscle strengthening. This is the hand grip strength test. Why we are using the hand? That's because when we are doing the exercise, when you think about the exercise, other than very few exercise except for the squat, all the time we are using our hand strength for doing the exercise, whether we thinking or not. So that's why when you are doing exercise, your hand muscle getting strengthening. That's why we use the hand grip strength as one of the indicator for the long life. We can do it. We are taking the measurement in 3 times and we are taking the maximum. Usually the maximum comes in the first and second attempts, and we are taking the dominant hand. The interesting thing is, if you are a right-handed dominant, there will be a significant power difference between the right side and the left side. But if you are a left-hander, there are not much difference. So that's a very interesting thing. And you can get the value by manually or the digital versions. This is the graph that we are using to check whether you are having a good grip strength or not. Right. Next one is coordination and balancing. This paper was published in the British Journal of Sports Medicine, and they have done a cohort study, and it shows that if somebody can't standing up 10 seconds in the one leg, his risk of dying is twice than those who can do that. So it's an interesting thing, taking the coordination as an indicator of the life expectancy. I just want to mention these three because these things are the indicators. You can improve these three by doing exercise. That's why we want to promote. There's a benefit, there's the parameters, then you can check whether you are fit or not, then you can do the exercise and these component, then you can increase your long life. Right, so I talk about benefit of exercise and how it affects your long life, but still we are not doing enough exercise. Why is that? We have to see why is it not happening. So I told you before that even in the world population, the 31% is physically inactive, and most of the inactive period is in your children's age, like 12 to 16 is the most physically inactive part in the human life. So we have to reduce that level. First thing is why we are not doing exercise. Exercise is a commitment. So you have to be committed. So unfortunately we are not much committed people. We can't commit for a lot of things. So you can commit for few short period, but you will giving up. That's one of the reasons. Other thing is it takes some time to show the result. It means when you start up running or the exercise in the gym, you will feel the euphoria and the happiness and everything initial 6 weeks, but for having a physically measurement changes, it will take at least 6 weeks. So if you can't stay focused for 6 weeks, you can't continue the exercise. That's why the gymnasium all around the world giving the packages. So their package, if you are taking the package for a year, so the price is 50% drop. If you are buying it for the monthly, it is higher up. But still they are promoting yearly because they know very few people are continuing yearly exercise program. So usually people are doing monthly program. So it takes some time, so you have to be patient. Other thing is, even though you have done the exercise long time back, even at the national level or the international level, if you stop playing, you come back to the normal level again. So you have to take a lot of time for achieve, but it is going back within short period of time. So the usually what they say is, if you stop doing exercise for more than 2 weeks, then it's high risk to stop the exercise. If you can stop for 1 or 2 days, that's fine. But if you are not do exercise for continuous 2 weeks, that means you are not doing exercise again for some time. Another thing is, as a doctors, we know we are doing the job with physical and mental exhaustion and lack of sleep, high stress. So when you finish exercise, you will feel lack of energy. So when you feel lack of energy, we can't do much exercise. That's why we have to find the correct time to do the exercise. And also with the osteoarthritis, when you have the joint pain, you can't do exercise much. And if you have any myocardial infarction like diseases, you are reluctant to do exercise. Other thing is the cultural issues. Unlike in European countries, in Sri Lanka, the females are not doing much exercise in the outside because of the issues and the attire and the perception. So those things is one of the barrier to do the exercise. When we are organizing the exercise programs, usually their request is to make it 2 sessions, one for the male and one for the female. So they don't want to do in one session. So we have to respect that part as well. Other thing is the proper facility and the practical issues. The first, when you ask to do exercise, the first thing comes into your mind is the gymnasium, right? So no one think of doing exercise at the house. That's the part that we have to mention. You can do exercise at anywhere, at any time. It's not compulsory go for the gymnasium. It's up to you to decide that. Right. So we talk about the introduction and the benefit of exercise, how the long life from the exercise, and why we are not doing exercise. Then come to the bad part. Is there any bad effects in the exercise? So these are the few examples that I see through the social media and the newspapers. So when you talk about these everything, what you can see is this is all related to the sport, not with the normal day-to-day exercise part. So when you do high intensity exercises, then there's a risk of having side effects. That's why I mentioned about the therapeutic range. I just want to mention about the Sajith Mallikarachchi. He is one of the Kandy rugby captain, and once he's retired, he did some just a tap rugger kind of a thing after a long time. Then he suddenly had his sudden cardiac death. So the reason may be because he has done a lot of strenuous exercise during his playing time. After that, he must have dropped out that one. When you try to do that again, you are having the different heart than those years. But you will, from the mind, you will try to be like the professional level, but your body, it is not. Then this problem is occur. Right. When talk about the side effects, exercise changes our intracellular and extracellular component in the body. So because of these changes, if you are fit, you can overcompensate these changes. But if you are having the genetic vulnerability, or if you are having the underlying diseases or environmental conditions like heat or the cold, changes these things and giving the bad result. So when we take about the exercise, this is the very important curve. If you're not doing any exercise, there's a high health risk, but our guidelines, the current guideline of doing the exercise in between, when we do more than that, you are increase the risk of health risk. So when we take these two photos, the one in the left side is kind of a very healthy man having the good muscular structure and running. This is the mid-distance runners. And when you talk about the other person, this is an ultramarathon runner, world-class player. But look at him. Less muscle mass, less fat, sunken eyes, very distinctive facial features. This is because of the free radicals forms during the ultra-endurance running. That's the bad part of the exercise. So this is not healthy. Running ultra-endurance is a sport. If somebody is doing it as a benefit of health, it's a different issue. So you have to decide whether you are going in that pathway or the healthy pathway. Right. So when we talk about the side effects, when we take the heart, so athlete heart is when you do any exercise, especially the cardiorespiratory or the strengthening part, your heart also kind of a muscle, it will responding and it is increased in size, and because of that not the cardiomegaly, but it is increased size according to your response with the exercise. That's called athlete heart. And there are some micro tears happening, and which will cause muscle fibrosis, and which leads to the arrhythmia and the myocardial infarction and the sudden cardiac death. When you take the respiratory system, if somebody is having the asthma, may go for the exercise-induced bronchospasm. The important thing is the metabolic response. This is a hypo or hyponatremia. Hypoglycemia is very unlikely with the sport because of the hormonal, because of the cortisol. So it is tend not to drop the glucose level, but hyponatremia is one of the worst thing. You know that when we do the exercise, lot of water is go out from our body, so you are becoming dehydrated. And also when you do exercise, most of the sodium chloride is leaving away from the body. So in your body, when you do exercise, you are dehydrated and your sodium level also low. What will do with the exercise? In those days, what they say is when you do exercise, drink a lot of water. Drink as much as you can while you are doing the exercise. What will happen then? When you drink more water, your sodium level get diluted and it will lead to cerebral edema. Most of the collapse happen in the marathons and the ultramarathon and the triathlon because of the hyponatremia. So be cautious about it. Now we are recommending is drink for the thirst. If you are not thirst, don't drink it. Just take the sip of it. Don't drink gulp of water at once. That's very dangerous. Other one is the DOMS. It means delayed onset muscle soreness. When we go to the gyms, even in myself, when we are going for the gyms, when we are in the young age, so the instructor, what he want to show us is giving the weight hard much as can ask to do in the first day. Then definitely next day we will have the severe muscle pain. Right? අර යාලා කියන්නේ ඇඟට දැනෙන්න exercise දෙනවා කියන එක. This is a totally wrong technique. This is not good. So we think that then only it comes into the body. Nothing like that. So DOMS is very frustrating symptom. So it will take some time to take time to resolve it. So when you do the exercise, don't start with higher intensity. Start with lower. Then you can manage. Other very important one is the rhabdomyolysis, the very significant one because of the myoglobinuria. This is more common with the CrossFit. The CrossFit is one. The CrossFit, the problem is they are using explosive exercise schedules without monitoring. So when you do more high intensity exercise without the heat, it causing more rhabdomyolysis. There are few incidents happen even in Sri Lanka, exercise-induced rhabdomyolysis. Other one is the environmental factors like heat injuries, heat exhaustion, and the cold injuries, high altitude injuries, and the diving. Other one is the hormonal response. This is very common with the females because when they are doing the sports, they tend to cut off their energy. And because of that, their fat layer is getting lower. We know that this fat layer is important for the females to keep their reproductive drive. So their hormonal imbalances happen, and this leads to a lot of overall body disasters. So these are the side effects of doing exercise. Other thing I want to mention is about the sport. This one I told about how the change the sport with the exercise. Doing a sport is a healthy thing. You have to encourage people to do sport. But the problem is when you are going do more exercise with the competitive and the elite level, then the problem starting. So there are a lot of injuries. It's related with the overtraining syndrome and energy deficiency. And one of the main important thing is reduce immunity. Those who are looking after the team, Dr. Upali and Dr. Ranaka will be agree with me that during the rugby season, we are more worried about not the injuries, about having the upper respiratory tract infection during the season. When the rugby players, they look like very fit to you, but their immunity level is very much less. So they are very prone to having upper respiratory infection, skin diseases, even any kind of infection bug, it is spread in the team. So we have to be more careful. That because when you do the exercises for the moderation, it will improve your immunity. But if you do more exercise than 3 hours, then your immunity is dropping by. So you have to be more careful when you do high intensity exercise for the prolonged duration. Then people can ask, then we can give medicine like anti-inflammatories, vitamin C high doses, vitamins K. So why we are not giving it? When they are practicing, if we are giving the tablet to reduce their stress level, like giving antioxidant like vitamin C, what will happen? The person is not adapting. I think you can understand it. During his playing, what we need is to player to adapt for that particular exercise. If we are giving antioxidant during his playing time, we are not letting him to adapt. So even though we are doing the exercise, it won't give the result. That's why we are not giving any vitamin C or vitamin K or any antioxidant during the training period. Only we are giving during the season. That means match period only. So that's a two concept that we have to use when comes the sport people. Right. Now we discuss about the benefit of exercise and the bad side of the exercise. If there's only benefit part, we don't need the screening process, right? There's a side effects part, that's why we need to screening process. Unfortunately in Sri Lanka, this is not happen much. So in the future, we are planning to implement this. The left hand part is the PARQ. This is the screening questionnaire we are using. If somebody want to do exercise, if you are a non-medical person, then you can fill it these 7 questions. It is about asking whether you have any symptoms when you are exercising, chest pain or dizziness, or are you on any kind of drugs, are you having any joint pains. So if anything is positive out of these 7 questions, then you have to go for the medical person like the doctor. It's called the PARMEDEX. It will a very long list of things that you have to check. So after you fill it up the PARMEDEX only, then you can prescribe exercise. Usually what we do is ask the person, if you are not physically fit, do some exercise, but that's not enough. You have to give the guidance, you have to give clear indications. This is the indication that we use. This is by the American College of Sports Medicine guideline for the screening process. There's 2 arms. One is the person have not done any kind of exercises. One is the one who doing exercises. In this process, we are more concerned about the cardiovascular disease, metabolic disease like diabetes, and the renal disease, because the important thing of the diabetes and the renal is it changes your internal environment. It is change your metabolic system. As I told you before, the exercises act on the metabolic system, so you have to have the good optimal condition if you are want to do the exercise. As a summary of this whole part, if you don't have any kind of disease, you don't need, if you are between 15 and 65 years, you don't need any screening program to do mild to moderate exercise. You don't need, right? But even though you are healthy, better not to start with vigorous exercise. Vigorous exercise only giving you more side effects. So you have to be gradually increase and adapting your body. So if anybody is having symptoms, he has to seen by the doctor, clear that part, then only ask him to do the exercise. Then you can go with the mild to moderate exercise. If you have this kind of diseases, if you want to go with high intensity, again you have to make laboratory or subjective or in the ground level checking before you are asked him to do the exercise. That's very important. Right, now after the screening, I'll talk a little bit about the component of the exercise. Exercise is not only about running. When we talk about the exercise, what comes into my mind is the running, like the cardiorespiratory. It is not. I show you before that the long life is depend on not only the cardiorespiratory, with the resistant exercise and flexibility and the coordination. Only another 2 things adding up. One is the warm up and the other one is warm down. So talk about the exercise, we are giving the FIT principle. It is the frequency, intensity, the type, and the time. So we'll talk about the warm-up period. The warm-up, don't waste much time for the warm-up, unnecessary. It's like if you are doing 30 minutes of exercise, 3 minutes of warm-up would be enough. And you don't need to be sweat. The misconception is you have to be sweat to have a warm-up. Nothing like that. If you feel your heart rate is increasing, that's enough. That's kind of a warm-up. One of the ideal one to do warm-up is the dynamic stretching. The photos that I'm showing it in the other side. So dynamic stretching will cover warm-up as well as some of the movements in the body. You can do it very quickly within less than 1 minute. So you don't need to waste much time for the warm-up. Right, then according to the WHO and American College of Sports Medicine, the recommendation for the exercise for the cardiorespiratory, I told we are talking about the FIT principle, the frequency is more than 5 days. Why is the 5 days? That's because what they say is, if you are doing exercise, it should be a life habit. If you want to do something as a life habit, at least you have to do 5 days per week. Doing 1 or 2 days, it won't give it to you as a life habit. That's why particular about having more than 5 days. And intensity I will talk about in the next slide. Mild, moderate, and vigorous. And the time, usually initially it started with moderation of 150. Then 2 years back they increased up to the 300 minutes because of the importance of doing the exercise. The important thing is, when you take the mild exercise, the time is 600, but if you are converted into the vigorous exercise, you have to do 100, right? So it is very much less. So you have to increase your intensity to spare your time rather than doing exercise throughout your day. Another thing is, these exercises you don't need to do at a stretch. Like 300 per week means 5 days, it means 60 minutes, kind of a 1 hour. So you don't need to do 60-minute exercise at a stretch. You can cut it down into the 10-minute bouts and do the exercise throughout the day. The benefit is the same. Those days there was a misconception that you have to do 20 minutes of exercise to have a benefit. That's a wrong conception. 10 minutes bout, even a 5-minute bout, if you are accumulating end of the day up to the particular amount of the exercise that you want to do, that's totally fine. So you don't need to worry about the time duration. Take the break, do it, take the break, then you can achieve the target. Intensity is the most important thing. Subjectively, we can go with the talk test. Usually we are giving the advices according to the talk test. So it's like this: when you are running or the jogging, if you can sing a song that it is the mild level of intensity. When you are walking, you can't sing, but you can make the conversation with the other person. That's moderate level. That's the part that we are asking you to start it with. Then you can increase intensity. You can't make the continuous talk with the other person. It means you are doing the vigorous exercise. Other than these subjective measures, you can use the RPE, rate of perceived exertion, like the pain score. You can ask 10 is the maximum, 0 is the no exertion at all. So according to that, you can plan your pain, the exertion score. Then we can go for the maximum heart rate part or the METs. So I think the subjective measure would be ideal for us to have an idea. Then for the resistance exercise, this is the forgotten part when you're doing the exercises. In our culture and in the Sri Lankan setup, we are not doing enough resistance exercise. We have to lift the weight. That's the new concept. It comes into even in the world. We are forgotten about the resistance exercise, the importance of doing the resistance exercise. But now the importance of doing resistance exercise is important, because when you are getting older, you are having the sarcopenia is causing much of the disability. To prevent that, you have to do resistance exercise. As an example, you can take the cyclist. We think they are fit, but cycling is kind of a cardiovascular exercise with some resistance, but when you check their muscle amount, they are it pretty much less. So when the cyclist comes to our clinic, we are recommendation it to the go for the resistance exercise. When you do the resistance exercise, this is the 5 component we are more focused on. The big muscle group: chest, shoulder, core muscles, back, and the leg. We are not focusing about the hand muscles. It will increase the strength while you are doing these big muscles. Bicep, triceps, we are not focusing about those stuff. So focus on these areas. One of the 3 staple exercises are push-up, squat, and the deadlift. So if you are doing these 3 exercises, covering most of these components at the same time. So if you don't have any time to do resistance exercise, go to the gymnasium. Even at your home, you can do 3 exercises, then you can have a good strength into your body. So when you do the resistance exercise, make sure you have to do only 2 or 3 days per week. It means you have to give at least 28-hour rest period for the particular muscle group. Because when you do exercises, we are making a micro tears. The tear has to be healed, otherwise you are making it worse. So this 48 period is ideal. Then intensity is moderate to vigorous. We are using this scale, the Omni scale. So you use around 5 to 6 level at the initiation. This is just for the subjective value. Right, then most important thing with the resistance exercise, how much you are doing it. Usually resistance exercise better not to do more than 30 to 40 minutes, and repetitions 8 to 12, and the 3 to 4 sets. I will talk about this in this slide. Our recommendation is the red part. We are going for the hypertrophy part. It means you have to lift at least 70 to 90% of your maximum weight. Repetition 8 to 12, set 2 to 3, and rest period 60 to 75 up to 90 seconds. And you have to more concentrate on eccentric part of the exercise. It means if you're lifting something against the gravity, it is concentric exercise. You have to do it little bit quick. Then when you are putting down towards the gravity, you have to put it very slowly. Then the eccentric part comes. Then the part the muscle tear is happening. That's the part we are using it for muscle building up. So you have to more focus on eccentric part of the exercise. Coordination, I talk about the single leg standing, and you can single leg standing, lifting your legs, close your eyes, those kind of exercises you have to do for the longevity. And also after the 50 years, your coordination is drastically dropping. It will lead to the hip fracture. So you have to more concentrate on coordination and balancing when the elder people comes to you. Then after that warm down period, we have to do the static stretching part, because we are not doing static stretching at the initiation. It will causing more tendinopathy. So to prevent that, we are doing static stretching after the exercise. Right, few last part of my lecture. So this is the few practical points before you doing any exercise. After you are warming up, please do coordination and balancing exercise as a first exercise, because when you are exhausting, you are losing your coordination and balancing. No point of doing it after exhausting exercise program. So doing it initially. And also if you are planning to do cardiorespiratory exercise and the resistance exercise at the same time, first do the resistance exercise, then go for the cardiorespiratory. The reason is for that, when you do cardiorespiratory exercise, we are using the liver glycogen and the muscle glycogen as a substrate, carbohydrate. We have only 300 to 500 grams. So it will deplete it very quickly. Once it depleted, if you are trying to lift the resistance exercise, you won't have any power. You feel exhausted. So so you can have a maximum tension. So you have to do resistance exercise first, then go for the cardiorespiratory exercise. But usually in the gymnasiums, the other way it's happened, because when you do resistance exercise, because of the muscle contraction happen in the muscle level, you feel pumped. When you go outside, you want to be very big, right? So that's why people tend to do resistance exercise at the latter part, but you have to do it other way around. Other thing is, when you do exercise, before putting the intensity, cover up with the time, like the frequency. Make the frequency 5 days per week, 30 minutes. Achieve that target, then increase the intensity. Otherwise, you will have muscle damage, joint damage, and other conditions. So always achieve your time and the repetitions. You need to have improve your bone strength. For that one, you have to do the resistance exercise, especially jumping exercise. Jumping jacks, the skipping or box jumping. If you can do that, that's ideal, because doing only cardiorespiratory exercise won't increase your bone strength. You have to give a stress to the bone to make it strong. Other thing is, you have to change the routine in every 10 weeks. It means our body is adapting all the time. So we are made for keep our energy for the latter part. If there's a disaster happening in the few days time, so we are keeping our energy. So always bodies try to stay in the steel mode. So if you do the same exercise for more than weeks, the body knows that now you are going to do this exercise for this repetition, this time, this setup. So body in a cruise control. So it is not expending much calories. So it preserving energy. So we have to trick our body, cheat our body. So that's why you have to change your routine. If you are a runner, don't run all the time. Change into the hiking, cycling, or the swimming in suddenly decision. Then it's give a more good results. If you are going to the gym, that's why most of the time the gym trainers, whether they know it or not, changing it. Like every 10 to 12 weeks, we are changing the routine and the schedule, right? That's to not to get used the body for the particular exercise. That's very important one. And also the muscle memories. Years back you might lifting a lot of weight, now you have not done it. But if you go to the gym today and start up today, you will achieve that target very quickly, because that the lifting memory is in your muscle. So you will take a very less time to come into your track. So that's why we ask not to stop doing exercise, because you can come very quickly into your previous state, not with wasting time. Other thing is the dietary modification. That's one of the important thing. My advice is first change your diet. Otherwise, if you do the exercises without changing diet, you will eat a lot because of the hormonal changes in your body. I told you the body is trying to keep the energy. You will make more fat when you do exercise if you are eating a lot. So at least take 2 to 3 weeks, change your diet, make used to it, then do the exercise and the increase intensity. And the other thing is proper sleep. That's one of the important thing. Dr. Chandana will and the Dr. Chaminda will agree with me when we talk about the athlete in Kandy, especially in the Kandy. Every sport, every age group, everyone is practicing for 6 days per week. I don't know this formula comes into the picture. Everyone, I don't know, more than 95% of the people practicing 6 days per week. Useless. You are not giving time for rest, sleep, to recover your body. Then only when it comes to the under 18 or 19, you are having the injuries. So when it comes to the prime time, you are injured, no use of it. So think of it, if you are a father or uncle or anyone relation, first go through that one. Please make sure to have a good rest time when you are doing exercise. Another thing is, if you want to do the extreme, like when you start up exercise, it will secretion oxytocin and happy hormone, and you want to do it more. So you are when you are walking, next time you want to run, next time you want to go for the hiking, next time you want to go to the triathlon. That's how our That's how we are enthusiastic to do the exercise. But make sure have a good basic strength and training. If you want to increase the intensity, go regularly. Don't change it in a one day. Do it as a regular pattern. Right? My take-home message is exercise should be an individual design program. That's because some of you have a type 1 muscle fiber dominant or type 2 fiber dominancy. If it is a type 2, then you are a good quick runner and the lifter. If it is a 1, you are a good runner. So know about your body. According to that, make the program. Keep it simple and the repetitive and the enjoyable, and make it a life habit, and make sure to cover all the component in exercise, not only one part. The journey is not easy. Most of the time you will fail, but don't stop it and try to start up again. You can achieve the target eventually. Thank you very much.